Hello, good morning, everyone. And let's now move on to the panel. Today we have a very interesting panel on patient empowerment. And I think with an interesting panel also with two representatives of startups and a representative from the industry and a representative from patients. And I would like first give you the role to ask you to present yourself in a first round. So that you can present to the audience where do you come from and which is your role. So please, first Ana Castellanos.
Hello, good morning everybody. Thanks, first of all, thank you very much for having us. My name is Ana Castellanos and I work for the Plataforma de Organizaciones de Pacientes, the Spanish platform of patients organizations. And I work here for almost 1 year now. And my role is as a project manager. And my background is related mainly to international marketing, communications, and basically that will be me.
Thank you. Pedro, please.
Thank you. Thank you for having me. Thank you all for being here, attending the panel. My name is Pedro Arce. My role is Digital Innovation Strategy Manager in Novartis, more particularly in the oncology division. Well, we try to reshape the way and reimagine medicine through digital transformation and innovation. So happy to be here and share our initiatives and experiences with all of you.
Hello everyone, my name is François-Guirec Champoiseau, very happy to be here. My background is mainly entrepreneurship. Today I'm the CEO and co-founder of Cureety, a startup I built 3 years ago. Our mission is to improve the everyday care of patients suffering from cancer. And we also work alongside academic research groups to help assess innovative drugs in real-life conditions.
Javier.
We have to share this one. My name is Javier de Oca. I'm the CEO and co-founder at Iomed. Pleasure to be here as well. Thank you very much for the time.
Okay, so thank you for the presentations. Now I would like to start asking the four of you a question around what do you think, according to your experience, that are the main benefits that patients have because of the role of digital health. What we know about the World Health Organization is already saying about the potential of digital health to improve health and well-being of people. And what do you think about it? What do you think are the main benefits that we can have? Who wants to start?
I can start if. All right, from our perspective, digital transformation is having tremendous impact in all industries, in particular in healthcare. And the benefits are multiple. I would like to focus today into positive effects that we found. The first one is that it allows a more personalized, preventive, and predictive healthcare. And as it goes from the entire patient journey, starting with early prevention, screening, the diagnosis, the treatment, and the subsequent management of a health condition. So the digitalization can help in all those processes. And for people with chronic diseases, this is crucial as they have to follow medication and treatment guidelines and healthy lifestyles to take care of their health. And here comes the second positive effect that we found, that is the improvement of correspondability. We consider that as much information and better information we have, we can take better decisions too. So improving correspondability is essential, and we wish as citizens to own our own health data and to have control. We want transparency and convenience. We want to have choices and to make these choices based on reliable information and trusted advice. So I think it's essential to have this access and control of data, of health data, in order to better control all the health process As we understand and comprehend what is happening with our health, we can also manage better, and we can improve also the health outcomes. It's proved that the medication adherence can also improve. We can have a better communication with our clinicians. And it's very important to bear in mind that apart from the time that the patients spend with physicians and with the nurses, apart from the time they spend thousands of hours a year developing activities that have a direct impact on their health. For instance, what should I eat? What to drink? What kind of activities or exercises are convenient for my health condition? What kind of medical advice should I follow? So we consider it's needed to make a shift in the balance of care from the clinician and the hospitals to the community. So this would be our reflection about this topic.
Super interesting. Thank you, Ana. Javier, what do you think about that?
Well, in more generic terms, the progress of digitalization and innovation in healthcare has the potential of bringing some of the most used terms around patients to reality. For instance, we've been talking for a long time about patient centricity. We've heard this term hundreds of times. People are smiling here in the public, so I'm on the right spot. We've been using this term for a long time, but it's been just a term. It's been just words. It's been a wish, a desire, but it's not been a reality. Innovation and technology are bringing the tools to make this a reality and to bring this term from the theory to the practice. And there is something that starts in every single aspect or in every single stakeholder around the patient. Starts with the clinicians, goes on with the rest of the hospital institution, affects us as innovators, affects the big corporations, the patient associations, affects everyone. And technology, if well adopted, if well placed, has the potential of making this a reality. Let's share some examples. If we move the hospital information that we already have and really transform it from a process-oriented information into a patient-oriented information, we're going to make a huge step. We're going to change the way healthcare is delivered on site in the hospitals, just by changing how information is structured, how information is collected, and how information is stored. And that's just a tiny example. Let's move on to, for example, fully patient-centric processes around telemedicine, for example, telehealth. Predictive medicine, you were mentioning that as well. All of these processes are technology-enabled, and they have the capacity of really placing the patient at the center, but in a practical way, not in a theoretical way, not in a potential way, not in a terminology way, in a real way. Patient is going to be the center of these activities. And this is possible because we are innovating in this sense. It is possible because we are adopting technology in this sense. I think this is the greatest advantage that patients can deliver, that patients can absorb from the technology or from the processes that we are innovating at the moment.
I agree, and this also opens a lot of challenges that this is posing, but we'll talk about this later, I think. Please, Pedro.
Thank you. I very much agree with Javier in the sense of taking a step back and not going to the granularity, right? Technology is enabling us to, from pharma perspective, to be better at research and development and clinical trials. AI, machine learning is benefiting us all for a more advanced data management system. But when we come to the patient, I think there is already a trend of willingness and eagerness to provide as many data as possible to the physician to create this, really accurate diagnosis. There is a lot of opportunities there that the current health system cannot, fulfill because of the imbalance between the time a physician has to dedicate to a patient. And the technology enables all the players, and there's where the co-creation comes, to put their little piece of benefit into the system. And that comes in a long journey. I think that other industries have understood before that we need to be more open, and technology creates openness and open doors for you. In general, and coming back to Anna's point, in all the patient journey there are a lot of benefits. We just mentioned about the diagnosis, but also on the treatment, in the management of the disease, the patient reported experiences measures rather than outcomes is something that we should start to focus as a trend. Let's give the voice to the customer, to the patient, on how he's feeling, how he's experiencing. And let's leverage and capitalize on those data to create a more personalized experience for them, for the treatment, for the diagnosis, and for the post-care, for the care management. So I think holistically, we need to really focus on the patients, as you mentioned, understand them better, and enable an ecosystem, playing with startups, playing with patient associations and big pharmas as hospitals, so that we can put the patient in the center based on data, always being, of course, compliant and protective with this data. But I think that the technology is far above or far beyond what we are exploiting today. So let's focus on trying to get more from it.
François?
If I may just to complete what has been said with maybe a little practical example for patients that are undergoing treatment, how technology can really help them in their care management. I will say that the benefit of remote monitoring is what we do has been proven in the US with a big randomized clinical trial. And basically, it's not digital that is a magic and helping improving quality of life of patients or survival of patients. If you can improve these factors thanks to digital, it's only because there are human people behind it that are able to proactively react to the issues that are reported through a digital manner. So digital is one part of the equation, but we really need to reinforce the teams and the healthcare operators in the centers to accompany this new technology. Otherwise, there won't be any scalability of the use of these tools, and it won't be working. Basically, when you have severe side effects or potentially severe side effects, you have two types of profile. You have the ones that are very anxious and that need to be reassured or oriented toward the emergency room or contacting the hospital. And you have the one that think it's not too severe, they can fight it, and they won't tell the doctor because they prefer to be strong. For these two types of people, we really need to reassure the ones that could feel very anxious with minor adverse events and prevent other patients to access to doctors because of minor adverse events management. And remote monitoring can really help for this type of patients. And for the other type of patients, we will need to educate them to engage with the hospital, because when an adverse event is taken care of too lately, you get a treatment suspension, an emergency hospitalization, and this is what we call a loss of chance. Another thing we can do with digital is to really harmonize the way patients can access digital supportive care services. In many comprehensive care centers, we have supportive care services that are here to help patients improve their quality of life. So you have physical activity coaching, nutrition, you have hypnotherapy in some of the centers, a lot of psychological support as well. But these services are not provided everywhere with the same quality, and are not available for every patient. So what we can do thanks to digital is to try to digitize as maximum as possible these patient services, so that we can help the system fighting with the inequality of care offering. So that will be my two remarks with this benefits of digital for patients' empowerment.
Okay, thank you, François. So now I would like to move to that you can go a little bit into detail on what you are doing in your organizations with regards to patient empowerment, or what are you working on, so that all of us can know about your organization and your approach to this topic. Please, Ana.
Yes, well, the platform of patients or organizations, we are representing 33 organization entities that groups 1,500 local and regional associations, and we provide service to 600,000 patients and their families and caregivers. And we work fundamentally in 4 lines of action. The first one is political advocacy and patients' rights. We are very active in this because it's tremendously important to build a robust regulation and governance model that put the patient at the center. And the second line of action is research. We are also very active on this. We develop studies to collect the needs and requirements that the patients have in order to make proposals to improve the system and the conditions. We also work in raising awareness around the different pathologies and the activities we develop, and especially in communication, we are very active on that too. And last but not least, we work in education, because we consider education is empowering too. As François mentioned before, building capacity is tremendously important to provide with information that can better help to manage a health condition, or is very, very important for us. And also education related in general with other topics for the associations can better manage and have an impact with the work they develop. So this is our work, and just to mention some examples about it, we have developed, for instance, the study related to the impact of the COVID-19 on chronic patients. We will be launching the last results very soon. And actually all the studies are available open in our website, www.plataformadepacientes.org. So you can take a look, and it's totally open for everybody. And we are also been working very, very hard to include patients in the vaccination strategy as a priority group. In order to protect them, as they are more vulnerable and fragile to the virus. And this will be summing up the things we do.
Thank you, Ana. Javier, please.
Okay, so quick introduction about what we do. We are a technology company. We have artificial intelligence tools that allow hospitals to transform medical records from unstructured formats into structured formats. So basically, from text to data, basically. And then we use this for clinical research, basically. And now the big question you may ask is, what on earth are you doing for patient empowerment? I like to highlight 2 things. The first one is something I already said in my last intervention quickly, which is the way we structure the information, so the way we place the information in the hospital. The information we start with, so the information we have at the start, before we deploy our technology into the hospital, is a process-oriented information, something oriented towards the health services of the hospital, but not towards the patient. This might seem like a minor thing, but it is not. Once we deploy our technology, we process the information, and everything hangs from a single point, which is the patient. And that's hugely important, because that provides our customers, both in the industry side as well as in the hospital side, with a perspective that is patient-centric when it comes to regarding the data. And this is hugely important. It changes the perspective of how we analyze data, how we check on data, how we look at the data. Changes absolutely everything. And it might look like a small thing, but it is not. And then I would say a more practical thing, which is probably one of my favorite use cases of Iomed technology, and that we are doing with several partners, is supporting what we call the value-based care. And this is extraordinarily important, and it is fully patient-centric. And that's basically asking that question and solving the question of, is this procedure actually adding value to the patient's life quality, life expectancy? Is this adding value? And we support this by offering the data that we have to measure precise variables on how the patient is doing, how the patient is evolving since the moment we change a procedure, a treatment, any line that we change on the patient. How is that exactly affecting the patient? How is that improving the patient's life quality with precise and exact variables? Good thing about this is we're not using a sample of patients. We're not using some patients that are representatives. We're using literally every patient whose line has been changed, whose procedure has been changed. And we're looking into the life quality, expectancy, and everything of every one of those patients as an analysis. This perspective is completely new. It's a completely new way of doing it. And it's fully patient-centric. And that's, I think, definitely from our perspective, one of the biggest things that we can bring to the patient empowerment environment.
And are you having, which is the feedback that you are receiving from patients? Can you explain a little about that? Or how are you involving them in the process of design of the plan?
The main feedback we are getting is coming back from the site, from the hospital, actually. But it is very encouraging because we are seeing that the results are positive in most of the use cases we have. We're not covering everything for sure, but we're doing it in very interesting areas in oncology and in other areas that are very crucial. And the feedback we are getting is very positive. From the sites, they are basically explaining us how these changes that we can measure are actually having an impact. Extremely encouraging.
Good news.
Very good news.
Yes, I will follow. Very interesting what you said, and I totally agree on the fact that the way informations are presented today in traditional electronic health record softwares is quite terrible. Like we have very old applications from the 90s that have not been very well developed and with a user experience that is very, very bad. So doctors and nurses really struggle just to get the correct information when they get a patient and then take proactively actions from this point. So it's very important to be able to structure this information, etc. Another thing, and I totally also agree with you on that, value-based medicine is really the future to improve patient care. And to do so, we need two types of data. We need clinical data, so the data that our clinicians are feeding into EHRs that will be further structured by companies like Iomed that are helping structuring data. And the PRO data, which is the one we are missing today in our healthcare system, is also as much critical than the clinical data. It's very important to be able to evaluate the efficiency of drugs in real-life condition in terms of survival, and this is what we can do when we have access to clinical data and electronic health record data. Having startups that are helping healthcare facilities to extract this data easily and share it easily, not on a too costly basis, is really important. And on the other hand, it's also very important, and I'm of course highlighting what we do. It is very important to take into account the patient experience. So basically, what is the burden of the disease of the patients? So you need to assess the quality of life, the symptomatology, and the therapeutic adherence. And this data is not collected by physicians on a daily basis. So we know that implementing PROs in a daily routine of care is both improving survival and quality of life of patients, and then is helping also health authorities, researchers, and industry all to better assess the burden of disease of data. It's not the same thing to have a treatment that will give you a 6 months survival better than the other one, if these 6 months are with a shitty quality of life. When on the other hand, having 6 months survival with a very good quality of life needs to be really valued by health authorities. So this is where we need to go. And to do that, we need to implement PROs at scale, and we need also to help hospitals to structure and share data, clinical data for this purpose at a much higher level than it is done today. So at Cureety, this is what we're trying to do. Basically, we definitely can partner with startups like Iomed, as they really are focused on the extraction of clinical data when we are focused on the collection of PRO data, which is totally complementary. And we should all work alongside academic researchers to help assess these innovative drugs in real-life conditions. As for the support services we can provide in the process, it is incredible what we can do when we have a patient-centric application. We can provide hypnotherapy session in a digital manner. We can provide physical activity coaching with the best coach possible. We can provide very high-end medical content also directly to patients to reassure them, to break the feeling of isolation. And yeah, the possibilities are tremendous, but again, with what I said earlier, all this needs to be supported with more healthcare operators and more financial resources for hospitals, otherwise it won't work.
Pedro.
Thank you, very interesting, all the points you raised. I would summarize in 3 things what we do at Novartis to foster patient centricity. First, we're reshaping the way we engage with our main stakeholders, physicians, hospitals, with a focus on what do they need to better treat the patient. So we're enabling new technologies that allow them to give better and more accurate information, more personalized information, new digital capabilities, and that's the way we use them as a proxy to better understand our oncology patients. Secondly, and probably really important, is to reshape the culture of the company, and this comes to the process-based mechanisms that are currently in shape. It happens as well in pharma. So we're creating a culture of customer obsession, and that means putting the patient in the center. We have been developing agile methodologies and creating self-empowered teams, and one of them is actually focused on patient empowerment and patient centricity. So we are understanding what's the future role of pharma with this real patient-centered focus and direction. And last but not least, we're launching several open innovation programs to startups such as Iomed, such as Cureety, that with your help we can actually deliver a better treatment all along the patient journey. So there are currently 2 open challenges for any startup that can, is eager to participate. One focused on the Cancer Startup Program that was presented last Tuesday, and it's based on 3 use cases. How can we enhance the overall patient journey and provide better treatment, not only for the patient but also for the HCP behind, which needs this financial and support more than ever. And the other one is the Melanoma Challenge, more focused on melanoma patients. So we as an industry have the challenge to get to the patients, and we associate, we work with patient associations, with panels more and more every day to actually get the voice of the patient and incorporate that in our current workflows. It's a challenge, but we're working on that, and I hope that we can tell success stories such as the startups that are today here are sharing in the future.
Okay, we mentioned already some of the challenges that we are facing, because you already talked about the need that the digital at the end is a means, it's not the end itself, and it really needs to have a real implication of health professionals and the health systems to really make this happen. I would like you to ask you to explain us from your perspective which are the main challenges that we are facing for patient empowerment.
Yes, I think we have a lot of challenges, but also it's very inspiring that the technologies go hand in hand with the patients, and well, we consider also as a challenge, as all the panelists are commenting, to really put the patient at the center, because it's a wheel, but it's not yet a reality. and empowering the patient in our perspective is giving them the data, but also the assets, I mean the resources, the technology and the education in order to process it. So for us, capacity building is a big challenge and is essential for patients and for patients' organization too. And we can extend this to other stakeholders, I mean from policymakers to researchers, to healthcare staff, and of course for citizens and patients. We need the knowledge and the skills, not just in technology, that is another world for a lot of people, but also health literacy, governance, ethics, that data protection and safety. There are a lot of top topics that have an impact in data, and we think this would be a big challenge. Basically, education, provide with educational opportunities to patients and other stakeholders.
Elena, challenges, adoption. That's a challenge. That's the biggest challenge. Technology-wise, it's solved. Data privacy-wise, it's privacy-wise, solved. Regulation-wise, kind of solved. We are there. It's adoption that's lacking. I'm not a huge fan of opening the data and handing the data to the patients. I'm not the biggest fan of this. Sorry, I'm not the biggest fan in this sense. I think the change is going to happen top down, not bottom up. But we need that adoption. We need that adoption from hospitals, from the main stakeholders. We need that adoption from the big industry, from the pharma industry, from the insurance industry. We need the technology adoption. And that's being slow, horribly slow. And I think this is the main challenge that we are having at the moment.
Yeah, let me put the question the other way around. What would we need for making adoption a reality?
Change your processes internally, make it faster. And I'm not talking about the industry, so the big corporations only. I'm talking about the sites, the hospitals, the governments. We need fast adoption of technology. I'm aware that we need to check technology before we adopt it, and we need to put barriers, and we need to place checks on the road, tests on the road. We need to do that, but still, there is fast ways of doing that already. What we are experiencing as a company, and we are seeing in the market in general, asking around here in a wonderful venue like this one, what we are seeing is that adoption is slow. And while it is slow, the checks are still not being done. So there are many adoptions that are done, are performed, are adopted without bringing the necessary checks. It's just too slow. What do we need to change? Internal processes. We need to change those in government entities. We need to change that in hospital sites. We need to change that around individual practitioners. We need to change that in corporations. And we probably need to change processes as startups and innovators as well, for sure. This is not a one-side thing. But altogether, we need to develop ways of adopting technology faster. Let me give you a very practical example. If you want to place technology in the public sector, as we do, it's a nightmare. It's a nightmare. If you want to do this paid by a third party from the industry, it's a double nightmare. Pedro is going to hate you for this. But it is true. It is true. We need to find processes that allow for a secure adoption of technology, and this is possible. This is perfectly possible. It goes through less bureaucracy, the good and precise bureaucracy around, security checks, the good tests. And at the end of the day, that goes down to one single thing, which is having the right people at the right spots in the processes. We need people with the knowledge for technology adoption in the key parts of the technology adoption process. And we're still seeing a way to go in there.
Yeah. Okay, let's continue. Yeah, François.
Yeah. So I would highlight, on my side, I would highlight 3 challenges and maybe some solutions, or part of some little solutions, I would say. First challenge is interoperability. Healthcare organizations have information systems that are really individualistic. Like for one hospital, you have one information system, and it's changing all the time from one hospital to another. Even when they use the same electronic health record, it has not been configured by the editor the same way than the others, so you need to rebuild the connectors all the time. And if you really want to do this interoperability, first you need the hospitals to unlock a budget to imply the IT department, and then they need to imply the editors of the legacy. So this is very, very painful. And what we see today is that digitalization of the public sector, even of the private sector, it's the biggest enemy of this is the public sector itself. They have quite some budgets for many projects, and they are often building their own solution, thinking that building a medical application for patients is as easy as being a doctor. Because they master being a doctor, they should be able to develop applications. So they are building their own applications. They are trying to implement them in their system, and it's not working because it's not their job to build such projects. So I would say that the state needs to orient funding for innovation toward interoperability with third parties that are from the private sectors and pure players in their field, so that hospitals really have the latitude to connect these tools to their own system. Second challenge to me is the fact that doctors and nurses, when they use telemedicine tools, they don't have reimbursed actions by using the tool. In France, and I think it's a bit the same in Spain, every action in a medical way has a quotation. So when you do a blood exam, when you do a PET scan, when you do a day hospitalization, everything has a price. When you manage an alert coming from a patient in a digital manner, there is no price, so there is no resources for that. If you set a way to finance and quote all the actions that you can do using telemonitoring tools and digital tools for patients' empowerment, then you make a lot of progress, because hospitals are able to really hire the good persons. And third challenges, it comes with regulation as well, but on the startup side, we have a good example of what's going on in northern countries. In Germany, we have accelerated programs to finance innovation and reimburse solution at a patient level, like 300, 500 euros per semester. These programs are really helpful for startups that are today depending way too much on pharma industrials. On our side, we only work with pharma industrials in terms of economic business model, because we don't have any other choice, and we would love not to be too dependent of them. So I guess it's coming in France. They are moving very fast on how bringing digital therapies to patients and reimburse this solution more widely. And I hope this will be generalized to every therapeutic area and in every European countries. So yes, interoperability, quotation of the use of digital tools on the patient, on the doctor side, and reimbursement of digital tools, also not to depend too much on pharma industrial, even though we need to work alongside them to transform the digitalization of hospitals.
Okay. Pedro, what do you think about that?
I think I cannot provide anything new. It's all been discussed. Interoperability, for me, legislation or regulation is something which is work in progress, which is not done yet, but acts as an enabler for any of the rest of the problems or barriers we see, right? So we need a more homogeneous regulation across the globe. It's not possible that we can scale digital health solutions in one country to another when the layer of regulation is so different among countries. You put a real example, working with public hospitals where Wi-Fi is limited, where they don't have the focus on technology, makes it impossible to escalate something that can be in a private environment, something more smooth to be implemented. But again, I think that other industries have lived how the regulation can unlock some challenges. I come from the banking sector and the PSD2.2, the GDPR, some things that were regulated 5-7 years ago and were not allowing users to have in a common app my positions in BBVA and in Santander. FinTonic would not exist if the regulation hadn't changed in 5-6 years' time. So I'm a strong believer that we need to push the regulators to keep on the pace of transformation, because there is a more uneven situation between how these guys are really, fast and rapid and innovative in their solutions, and the frustration of not being able to be implemented as fast as possible, and being disintermediated by big tech players. That's a real threat that we should all be focusing and playing together again. So again, just to reinforce, interoperability is one of the main challenges. Adoption for sure, but it comes when the enablement through policymakers and regulators are putting focus on that same topics.
Yeah, well, completely agree that the adoption is really a real challenge, and there are plenty of reasons why this is not happening so fast, plenty of them at different levels, governmental levels, implementation, health professionals. But I wanted to focus now on the health literacy aspect that you were mentioning, Ana. If you can elaborate a little bit more about the digital health literacy, what is the situations or the main challenges also in this field to address?
Yes. Well, we think that education is the best way to really empower patients, and there is a lack there also in general. I mean, we think that it is needed more education to really take more informed decisions and to really take part of debates as this is the case. I mean, to be fully prepared to participate and have a meaningful involvement in policy discussions or in the development of new technological solutions, or now all these topics are on the table, and only if we have the education and the resources to do it, we can really be engaged and add value. So this is from the perspective of a platform of a patient association, and this will be our point on this.
And what would be, and then for those patients that do not want to participate and to be involved in the decision, how can we then reach them, or what we can do in this case?
And they have. We are at their disposal. I mean, the patient associations represent a group of patients with similar conditions, and I think we make a role on that too. So it is the way we work. I mean, we involve the associations that are members of the platform, and they do tremendously work also in order to gather this patient voice. But of course, it depends on the person themselves. There is more a personality, a way of being. There are people more participating and more engaged. So, as any industry, I guess.
Sure. And then as a last question about the regulation, you all talked about some of the barriers and also regulation is necessary and it needs to be there, and we really need to put a great focus on that, and also for security reasons. What is your vision about the new GDPR and new situation with the regulation on that?
We're making very interesting steps in the right direction, and I'm extremely optimistic about how I'm seeing the last trends regulation at the European level. If I have to make a point in terms of how we can make it better, I would say we need an extra step in clarity in exactly what are the areas in which we can play as innovators and as adopters. So what is exactly the scope we have? What are the rules that we have in that scope? And I'm seeing wonderful examples in very close markets, and I would like to highlight some in the UK, for example. It's a market in which we are starting to operate, and we are seeing wonderfully clear guides of how to adopt artificial intelligence in the public healthcare sector, for example. We are seeing great guides on how to implement certain types of technology that affect the patient and that can be labeled as medical devices, for example. This type of clarity, that's excellent. It tells the innovators and the adopters exactly how they have to play, and that's hugely important. So if I have to make a point of, let's say, of improvement, I would say let's follow that model. Let's find a way of landing the usually confusing language of regulation into clear guides of how to do things that are, understandable to common mortals like us.
Good point. Pedro?
Yeah, if I may build on Javier's point, I think that all these cookieless policy, the GDPR, how the data your companies use from you when you navigate the internet is a really good trend we should follow. It comes into transparency and clarity of information, such as you mentioned. I think that there is still the population is not that willing to share all this data with how I feel, what's my disease, because of the lack of understanding of the terminology. It's a complex world, so giving more clarity on the wording and why would you be sharing this data with me as a pharma, with me as a physician, with me as a hospital, would enable a really spread of the data we have available for better purposes, for better management of diseases. So it's all around transparency, following the trend of data privacy, and giving the consent management to the user. Regardless, the historical and clinical data might be owned by them or others, but give clarity on what you ask for and what is going to be used for.
Very shortly, if I may, to build on what Pedro was mentioning, which is very interesting and very important, we need to change the way the language when we discuss sharing data and so on. We are always discussing the dangers of it. We're always approaching it as everyone around the data would be some sort of thief that wants to steal the data. We need to change that language into something positive and say, hey, okay, there are risks for sure. Here are the risks, but hey, these are the huge opportunities for you yourself, your immediate environment, your family, your immediate environment, and the rest of the society. This is the potential gains of sharing data. So changing to a positive approach on this.
30 seconds.
So yeah, one point, I totally agree that recent progresses in terms of regulation, especially GDPR, is really a great help for every actors in the sector. We all communicate toward our users on the use of what we do, the use of the data, etc. And when you educate people, saying very simply that data could be anonymized, further used for research purpose, etc., patients really agree with that. They don't care about the use or the reuse of their data if it's for research purpose and to improve the care offering. And second, we made many more progresses also, and Cureety will not exist without them in terms of research referentials. We really can use today data from the real life, and if it's anonymized, structured in a certain manner, etc. And the progresses on this side have really helped a lot. So today, many actors are exploiting and working on this data in a regulatory framework that is enabling us to do it. Maybe what we can do for the future is to help emerge European champions that should be the ones treating health data in Europe, not American companies. I'm sorry for the Americans in the room.
Very good.
If I can add the last thing, very, very shortly.
5 seconds.
All right. No, from our opinion, we consider that the regulation is very robust. I mean, we have a good regulation. The GDPR is a good framework, but there are still, as the panelists comment, a lack of definition of some key terms. I don't know, by regulation or with a specific code of conduct that is needed in order to apply harmonized standards, and every of the key players have the information, interpret the information, and can apply it properly. So this is our point.
Okay, so now it's 12. We're running out of time. Thank you to the audience, and thank you to the panelists, Ana, Pedro, Javier, François. Thank you very much, and we hope it's been of interest to all of you. Thank you.
Thank you for having us.